Hello again, it's Dr. Stephen Vernino from UT Southwestern Medical Center in Dallas, and I'm going to take a little time now to show you around the UT Southwestern Multiple System Atrophy Clinic in a brief tour. I wanted to start with this slide because I sort of think about MSA in terms of the patient's journey. They're traveling, and sometimes it feels like you're traveling up a mountain. You're not really sure where you're going to end up. And I think the goal is to try to find some beauty along the way. So hopefully that makes sense to everyone. Hello, welcome to the UT Southwestern MSA Multidisciplinary Clinic. I'm Dr. Vernino, the director of the clinic. I'm just going to show you around just a little bit. So our patients come in to our clinic. We're fortunate to have a nice, fairly new clinic building and enough exam rooms that each patient can spend the afternoon in their own exam room and meet with a number of our team members over the course of the afternoon. People like our autonomic fellow, Alita.
Hi.
And as they finish with one provider, they move on to the next one, and they get to quickly and efficiently see all the people that they need to see. And then down at the, while those patients are being seen, the team can meet down here in the meeting space at the end of the hall and discuss the cases, coordinate care, and plan for testing and other necessary follow-up appointments. So, so an important part of the clinic is having that space to discuss the patients and what they need.
I thought maybe you
could. This is the team doing some good work. So in our clinic, there's a control center, we like to call it, where the nurses, the coordinators, and the providers can check in and quickly make sure that as patients become available, that the next provider moves in to see them. As I mentioned in my previous talk, this is all guided by having a pre-visit survey that we send to patients in advance of the clinic so they can identify the problems that they want to specifically address during their visit with us. And that helps us schedule the timing of the different appointments that they'll see when they come to the clinic. So how does that look when patients come into the clinic? They'll be seen by the medical assistant who bring them back. And what's important, I think, is that the patients will be able to sit in their own exam room for the whole afternoon, and the providers will come one after another to visit with them. We're fortunate in our clinic space to have nice big rooms that accommodate wheelchairs and multiple family members very well. An important part of the check-in process is that patients will get their blood pressure checked, both the laying down and standing blood pressure, so we can see how that's working. It's important to have exam tables that are electric. They can get down low so patients can get on them easily. And then, as I mentioned in my previous comments, we always, as much as possible, do a bladder scan to detect any excessive residual bladder volume that might indicate that a patient needs to adjust or start on medications or may need to see the urologist in an urgent way. And especially in the new criteria for multiple system atrophy, urinary retention is an important part of that. And I think we've found in our experience that paying close attention to bladder issues can help avoid some of the problems such as urinary tract infections or kidney problems. So each patient, as they're in the room, we generate a patient schedule, and based on their pre-visit survey, we'll list a number of providers that they need to see. And as those providers go into the room, they'll check the box to indicate that they're in there, and that way other providers don't come in and interrupt. And once they're done, they check the box for being finished. And then at the end of the clinic, we should see a schedule that looks something like there on the right, where all the patient's planned visits have been completed, and then the medical assistants know that they're ready to wrap up and head on home. So this system works very well, and we use it in a number of different multidisciplinary clinics for different diseases at UT Southwestern in neurology. Research is an important part of what we do. So as patients join our multiple system atrophy clinic, we invite them to consent to be part of the MSA clinic database, in which we keep track of their assessments at each clinic visit. And the patients come on a regular schedule once every 4 months or 3 times a year. We can have other visits in between, but those are the the scheduled visits in which we collect a lot of research data from questionnaires that relate to symptoms, that relate to quality of life, and other features. In addition, by consenting to be part of our research database, we can quickly screen patients based on their clinical data on their eligibility for research trials as soon as those research trials become available, and then can reach out to them quickly through the contact information we keep in the research database. And that is very helpful because we already know that those are patients who are interested in research trials, and we've already collected the necessary data to evaluate their eligibility.
So this is Chidima, our nurse practitioner. Say hello.
Even the 3 in 1, right?
Yes, ma'am.
So our other providers work together, and you can see here at the control center, Dr. Wynn, our physical medicine doctor, is coordinating some orders with our nurse. And that direct person-to-person communication is really very critical to making sure that by the time patients leave, they have a very complete plan of action that includes input from all the different members of the team who've had a chance to talk with each other and make sure we're all on the same page. And as I had mentioned in my previous talk, another important aspect of the MSA clinic at UT Southwestern is the training of young doctors. So we have neurologists who are training, who have already finished their neurology residency and are training to be experts in movement disorders or autonomic disorders. And it's a very valuable experience for them to meet with MSA patients, to hear what's going on with them, and to see those disorders firsthand and learn from the experts, particularly because MSA can be a rare disease, and a lot of neurologists and others out in clinical practice may only see 1 or 2 cases in their whole career. So being able, so these fellows being able to train with us and see many patients many times a year is very helpful. So that includes neurology trainees, but also trainees from palliative care and fellows like that. And then finally, we try to provide through our MSA clinic some important resources for the patient. And so when they first join the clinic, they get a little folder containing a number of documents, not too many, but the one document is general information about the MSA clinic and how it works, how often they meet, and how to contact us. And so we want patients to be aware of how the clinic works. If they live too far away to travel to UT Southwestern every 4 months, or they don't feel like they want multidisciplinary care, want to continue with their single neurology doctor, that's perfectly fine. And we help guide them in that way, but they aren't members of our MSA clinic in terms of this longitudinal multidisciplinary care. We also give them information about multiple system atrophy in general and links to resources such as the MSA Coalition. And then finally, patients have found it very helpful to have a letter from our doctors that explain MSA to other providers that they may see, such as emergency room doctors when they show up in the emergency room. So that form, it's a page and a half that tells the ER doctors a little bit about multiple system atrophy. For example, it says, I have speaking and walking difficulties, and it's not due to being intoxicated. It's because I have a neurological disease. Has information that my blood pressure will be very up and down, and please don't overreact to that. And gives information about how the ER doctors can contact the MSA experts at UT Southwestern. And then finally, down at the bottom of the page, there's a few statements that the patient can fill out, indicating to other doctors that they may encounter whether they have a medical power of attorney, whether they have advanced directives, whether they have a do not resuscitate order. And then finally, some information about if they really want to donate their brain and how to contact the brain donation service at the time of their death. And so having all that planned in advance, our patients have found very useful, and most of them carry around this sheet of paper with them wherever they go. So thanks very much for listening and seeing how we do things at UT Southwestern. It's a work in progress, and we take input from our patients all the time. We try to bring in new experts when they're available and when there's patients that have needs that we're not addressing. But it evolves over time, and I think we have developed a very efficient process where patients can come in, get many of their multiple symptom concerns addressed in a single clinic visit that can be done in about an hour and a half, seeing all of our providers, and then go away with a real solid plan about what to do next, and also have access to resources such as counseling and research opportunities. So hopefully this multiple system atrophy model will be something that will take off at other places around the country. There are a number of MSA multidisciplinary clinics now operating, and you heard from some of my colleagues earlier. And the MSA Coalition is working hard to define some of the best practices for these clinics. And so now I think we'll take some questions and answers.